Hello everyone. My name is Upasona Dash. I am an MSc tutor in Shrishi College of Nursing, and today I will be discussing on the topic perspectives of mental health and mental health nursing. So we will be learning about the different perspectives of mental health. We will be describing how the biological, psychological, socio-cultural, and holistic perspectives are related to mental health. What are the different perspectives of mental health nursing and how these perspectives are important in providing psychiatric care, and what are the role of nurses in prevention, therapeutic care, and rehabilitation of the patients. So, mental health is not simply the absence of mental illness. It includes emotional, psychological, social, behavioral uh, well-being. The way we understand mental illnesses depends on different perspectives and approaches, and this different approaches explains mental health in different light and guides the type of treatment or the type of nursing care we will be providing to the patient. So as mental health nurses, it is important that we understand this perspective so that we can deliver a holistic and patient centered care. And another main thing is that we need to remember that no single perspective explains all the mental health problems that are going on in a patient. First, we'll be discussing about the biological perspective. So the biological perspective, it mainly explains mental illnesses as a result of the physical and physiological changes that are occurring in the body. This may include neurotransmitter imbalance, the genetic factors, the hormonal disturbances, or the abnormalities in the uh, structure of the brain. For example, depression, it is commonly linked with low serotonin levels. Schizophrenia, it is associated with dopamine imbalance. Then treatment under this perspective mainly focuses on pharmacotherapy, which includes drugs like antidepressants, antipsychotics, mood stabilizers, and sometimes we are also taking the help of electroconvulsive therapy. So the nurse's role here includes administering the medications, monitoring the side effects, ensuring that the patient is taking the medications properly. So we are ensuring that there is compliance, and we will also be providing psycho education to the patient. Now moving on to the psychological perspective. So it will be focusing mainly on the thoughts, emotions, personality, behavior, and how the patient is able to cope with the daily changes or the problems that he is facing in life. So the various theories that come under this perspectives, first is the psychoanalytical theory, which is focusing on the unconscious conflicts between the id and the superego. Next, we will be learning about, next is the behavioral theory. Behavioral theory mainly talks about that any thoughts, emotions, or uh, any changes in the personality, they come as we, because we learn them. Like in a certain time, we learn them, and these behaviors can be taught to someone. And if like some behaviors we want to change, we also can change those through proper interventions. Cognitive theory, it is based on the faulty thinking patterns of the brain. So the therapies that mainly come under this psychological perspective is cognitive behavioral therapy, counseling, behavior therapy, psychotherapies, different psychotherapies like mindfulness based therapies. So here the nurse's role will be mainly of establishing a therapeutic relationship, or getting into proper therapeutic communication with the patient, providing emotional support to the patient, and we will be constantly observing the behavior changes in the patient. Next perspective is the socio-cultural perspective. So this perspective, it explains that mental health is strongly influenced by the society or the environment where a person is living. So there are factors like family, environment, then cultural beliefs, and some social uh, factors like poverty, unemployment, social stress, which is affecting mental health significantly. For example, if a psychiatric patient does not have proper family support or social support, we can see that day by day his condition may get worsened and the patient will not show any changes. Then the coming to the holistic perspective. So holistic perspective talks that it is bringing every perspective into the light. We are considering a patient's biological, psychological, social, as well as spiritual aspect here. And it is very important in psychiatric nursing because patients here should not be treated on the basis of the symptoms. We have to identify where the patient is lacking in which aspect, and we have to plan care according to it. So the nursing role here will be like to involve the family in patient care, to support or refer the patient to community rehabilitation. And here we have to remember to respect and honor the cultural beliefs of the patient. Next, we will discuss the major perspective in mental health nursing. The first is the therapeutic perspective. So, in psychiatric nursing, the nurse patient relationship is very central. It is based on trust, empathy, acceptance, and communication. The second is the preventive aspect. Here we are working on three levels: primary, secondary, and tertiary level. So, primary, it will be mainly focusing on mental health promotion, awareness about different disease condition. Secondary, it is about early diagnosis of the disease condition and its treatment. So, we are diagnosing and the patient, we are assessing the patient, we are diagnosing what kind of illness the patient may have or what are the symptoms, and according to it we will be uh, providing care to the patient. And the tertiary, it is mainly about rehabilitation. We have to like focus what are we have to see that what are the functions that are intact in the patient, and mm, how we can help the patient to learn like new skills. And also another thing, it also focuses on relapse prevention. Then recovery oriented, it focuses on patient strength and it's and the patient's independence, rather than only the illness. It encourages like a hopeful dignity, a life full with dignity and meaning. Then another perspective is the community based mental health care. So today we are shifting from the hospitals to community settings. Psychiatric nursing is focusing more on the community settings like the schools, homes, clinics, and rehabilitation centers. So this approach, it is improving accessibility to mental health care and also helping the patients who are already uh, suffering from any condition to integrate into the society properly. So mental health nurses, they are involved in various roles here, like they are giving awareness programs, they're involved in counseling, home visits, crisis intervention, and also they are providing rehabilitation services. The next perspective is the evidence-based perspective, which means that whatever care we are providing to the patient, we have proper research findings on it, we have proper scientific evidence on it, and we have proper guidelines on it. So evidence-based practice, it will improve patients' safety, improve quality of care, and treatment outcomes. So we have to remember that mental health is multidimensional, and no, like we cannot treat a patient by only focusing on one aspect. Okay, we have to provide a holistic treatment to the patient. So we have to focus on biological care, we have to focus on the psychological support, we have to focus on social rehabilitation and holistic healing. So the key points from today's presentation are mental health is uh, multidimensional. Different perspectives help us to understand the mental illness more effectively. So mental health nursing is integrative and patient centered. Therapeutic communication, prevention, rehabilitation, evidence based care are all essential parts of psychiatric nursing, and most importantly, empathy and compassion are the foundation of mental health nursing. So we can conclude that there are different perspectives which do not compete with each other, that only behavior therapy will work or only counseling will work. They do not compete with each other, they complement each other, and this helps the nurse to understand each patient as a whole person and provide a more individualized and evidence-based care. So these are the references. Thank you.